Hi, everyone. This is Dr. Kelvis here to talk to you about Parkinson disease. Quick disclaimer, this is not direct medical advice. This is just medical information. If you do have any of these symptoms, it is highly recommended that you go see your primary care physician. So, what is Parkinson disease and is it hereditary? And the answer is yes, it is absolutely hereditary. Parkinson disease is a very gradual, slow, steady deterioration of some of the neurons deep within our brain. And these neurons are what produce dopamine. Dopamine is a very important neurotransmitter. It helps control movement, mood, a host of things within the brain. And for the sake of simplicity, it is just produced within the substantia nigra. That's a small part in the brain. And with time, patients have a very difficult time moving. They then develop, kind of mood instability. And as you've all probably seen, patients as the disease progresses, they have a very difficult time kind of initiating a movement and stopping a movement. They'll shake a lot. Um, so a lot of genes have been identified that play a role with Parkinson disease. There's currently 23 loci and 19 genes that have been identified. But something I really want to drive home is just because you may have a particular gene or an allele, it does not necessarily mean 100%, okay, you are condemned to having Parkinson disease. And there's a very important distinction to make here with transfer of genetic material, and that's, is it autosomal dominant or autosomal recessive? And again, I'm going to try to keep it simple here, but if a gene is autosomal dominant, it means that it is highly transferable. If you do get the gene from your parent, you will absolutely exhibit those symptoms. Autosomal recessive means there's a much lower chance that you will get the gene, that you will express symptoms even if you have the gene. And so it's called having kind of a variable level of expressivity within autosomal recessive. And, we can get into all kinds of deep, fascinating genetic stuff, but for this video, I won't. So there are a lot of genes for Parkinson disease that are either autosomal dominant or autosomal recessive. We're still trying to figure out specifically, okay, with this gene, we know for sure it's, say, autosomal recessive or autosomal dominant. We're still trying to figure out with these genes if certain genes cause early onset Parkinson or late onset Parkinson. I highly suspect within the next 5 years, we will have so much more of this stuff figured out because the technology we have right now is just absolutely fascinating with DNA PCR, especially, with the advent, unfortunately, of COVID-19. The ability for hospitals to rapidly turn around genetic tests has improved significantly to the benefit of all of these things. So now that patients will be coming to the hospital with these symptoms, it will be much more commonplace and quicker for physicians to order these genetic tests, and we immediately have results. And so current guidelines, I did a lot of research. Current guidelines do not actually recommend getting routinely tested for Parkinson. I professionally, respectfully disagree with this, and here's why. Because we need as much data as possible. Even if, say your parents have Parkinson and you never develop symptoms, you never develop the disease, it is still so important that we follow that and study that. Why did your parents develop or your mom or your dad develop symptoms, but you didn't? This is all still very important information I think we need to get. Instead of just following positive cases, we also need to follow patients that maybe have autosomal recessive genes and never exhibit symptoms. So let's see, I did also read about a recent meta-analysis that actually shows there's no significant difference between risk alleles for age of onset. So, and alleles is just a fancy genetic term to talk about how, the genes are transmitted and things. But that's actually a really good sign because most of people develop Parkinson and other monogenetic neurological diseases over the age of 65. But we are seeing a lot of cases where people develop symptoms younger than that. We've seen Parkinson disease as young as 40 disease. Okay, well, why do these patients become ill so much sooner? Are there just protective mechanisms within their brain that are failing? There is a plethora of research to show that Parkinson and other neuro diseases, they start decades before patients actually start showing symptoms. So, what can we do to figure out how to catch these patients at a very early age, before symptom onset, and then develop therapies to determine, to figure out, okay, can we treat this early on, actually find a cure, more or less. So only about 0.3% of the world's population currently develop Parkinson disease under the age of 40. That seems like a really small percentage, but that's actually a lot of people. So we currently have genetic testing available for a couple genes like Park 2, 7, and 8, Pink1, and SNCA, and that's just a lot of acronyms. It's not even worth going into what specifically all of those mean. Um, More research needs to be done to determine the efficacy of these genetic tests. And our ability to interpret them still remains somewhat limited. But again, like I said previously, despite current guidelines saying not to get routinely tested, I think if there are any Parkinson cases in your family, I think for the sake of research and future treatments, you should get tested. And this is something that your local physician can order.